If we are going to develop and get out of this, you need people from here who would stay behind and help with that. And I just felt from a very early time that I was one of those that would help with that. In Liberia, where you have about 4.5 million individuals, you have probably 150 doctors. It was a very, very intense headache. So intense that I saw flashes of lightning. And my heart was racing, I had a fever, and I said probably this is not malaria because I've had malaria about 1,000 times. And it never presented that way.
When he came and his son wanted to run to him as usual, he said, "No, don't touch me." He told me, "No one comes in my room to do anything."
Everybody played an important roles, but my mother played a very, very special role during my illness. She stayed and she made her own personal PPE with ordinary gloves that the women used to do hair.
Every hour or so I would go and call him. We call him Connies, not Philip. So, Connies, yes, Mama. How are you? All right, Mama. The voice was slow and ebbing.
I remember when the WHO, CDC, and other bodies were spewing out the epidemiological graph about how many people would be infected and how many deaths would be expected. That showed us that if we didn't get our acts together, this epidemic might wipe us off of the face of the map. And since we had this one big enemy, Liberians just rallied together and became united, okay, and said, well, we're not going out like that. We can't let our guards down. We need to continue effective and quality monitoring. At the same time, we need to strengthen our health system because if you don't have the stuff to do your work and then you have very meager salaries, it can be very, very unbearable to live in that environment. The first thing we need to do is to strengthen those things that we already have. That is the training of clinicians, retraining of clinicians, and paying them better. And the health centers are very, 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 very few, and then inadequate at the same time.
I'm not waiting for a new epidemic. We have epidemics that are going on here right now. HIV, malaria, tuberculosis. Ebola, the way it spread, the way it erupted, was part and parcel of having a weak healthcare system to begin with.
I think we should focus on diseases like malaria because those are the diseases that create the conditions for diseases like Ebola to come. As we shift from quick impact solutions to long-term solutions, the kind of investment that will work really well will be to have Liberian health professionals trained in Liberia.
I think if there is any silver lining to Ebola, it's that it's drawn attention to what the healthcare system was like before Ebola here. If we improve the healthcare system in general, it's going to be the benefit of the Liberian people, all West Africa, and it's going to make an epidemic like this much less likely to occur.
It was miraculous because Liberia, we don't have the human nor infrastructure resource to defeat Ebola. But if we could do that with Ebola, we can do that with everything else.